I went to medical school at the University of Ottawa in Ottawa, Ontario. Did my internship in surgery at the Montreal General Hospital and returned back to Ottawa for my training in orthopedics. Did 1 year of research in pediatric orthopedics, and then after that did another 3 years of orthopedic training, and then afterwards came down to the United States to practice. I initially had intended to come down to Murray maybe for a year or two as an adventure and then move on somewhere else, and that was 34 years ago, and I'm still here. What kept me here is the friendliness of the people in West Kentucky. They accepted me wholeheartedly when I first came here. I've enjoyed working with them, and it's just been a very pleasant place to live. Passion in my spare time is riding, tinkering, playing with motorcycles. My practice basically is a surgical super specialty in that I do only hip and knee replacements. We do primary hip and knee replacement for initial disease, but I also do revision surgery for implants that have either broken or have worn and need to be replaced. I think what sets me apart is the expertise I've acquired over the years through added training as well as by volume. I sincerely believe that the more often you do something, the better you can be at it. I am certified by the American Board of Orthopedic Surgery. I'm a fellow of the American Academy of Orthopedic Surgeons. In 1996, in order to improve my skills in joint replacement, I closed down my practice and went to Indianapolis and did a fellowship there with Dr. David Fisher at the Methodist Hospital, and then returned back here to Murray to practice. And I've been focusing basically on total hip and total knee replacement since that time. Total knee replacement, probably the name is misleading in that it implies that the whole knee is taken out and a new one is put in its place. Basically, I compare it to doing a retread on an old tire. It's a resurfacing operation. So much like you would take an old tire, scrape off the bad rubber and glue on a new tread, the knee is the same. We open up the knee and merely cut off the ends, the parts that are worn, and then resurface them with metal and plastic components. The knee that I use is one that allows a rotation of the plastic liner, both on the upper part of the tibia or shin bone as well as on the back of your kneecap. I've had very good results with it. I've done thousands of them over the years. What I like about it is that it has a track record. It has been on the market since 1977 and has shown that it has about a 90% 20-year survival. Patients often come to the office and they want the latest device that they saw on TV, assuming that what is new is better, which is not always the case. The surgical procedure itself takes about 1 hour to perform. The patients come in the hospital on the day of their surgery and they're admitted afterwards. Our hospital stay usually ranges about 2.5 to 3 days. None of our patients are put to sleep for this. They're all done under a spinal anesthetic, and we use a technique called nerve block where we numb up the nerves that carry pain away from the involved area, which does a lot to speed up the recovery. We do what's called a fast tracking, rapid recovery afterwards. By eliminating the pain in the first 24 hours, it really allows patients to get up and become very mobile. Our patients, both with a hip and a knee replacement, are allowed up to do full weight bearing the day after the surgery, start moving the involved joint, walking up and down the hall. And usually about midday on the third day, they're discharged home, in which case we set up home health physical therapy and home health nursing, which will go to the house for 2 to 3 weeks. And then if they need therapy beyond that, we just send them to whatever facility is closest to where they live, because we do a lot of patients from out of town. The accepted recovery for a joint replacement, both a hip and a knee, traditionally has been 3 months. This is what you would ask your boss for if you were telling him that you needed to have a replacement done. Truth of the matter is people recover a lot faster than that, and it's not unusual to see patients a week or 10 days after the surgery to walking with no form of assistance. The thing I do want my patients to know is that when they call to make an appointment at Murray Orthopedics to see me, I promise them they will see me. Not only on the first visit, but on all subsequent follow-up visits as well. That's been in my practice for 34 years and will remain so. I feel that I can offer them the most expertise in the field, and a lot of times their conditions require subtle diagnosis as well as an array of treatments that I think only somebody who's fully qualified can give to them. And I think if they come to me and put their trust in me as a board-certified, trained orthopedic surgeon, that's what they deserve, and none less. We have several surgeons in our group, and I think that if you add up the expertise that each surgeon brings to the table, that we can pretty well handle all orthopedic problems that patients can face locally. We have a good group of doctors, very conscientious, hardworking, well-trained. We practice in a state-of-the-art hospital that isn't afraid to rally and to develop all the latest techniques, to buy the latest equipment for us so that we can provide the best care. And as such, I feel that we offer good enough care in this town that there really is no reason why anybody should want to leave the borders of Murray for their orthopedic care. One thing our patients are made aware of and become aware of after the surgery is that our clinical outcomes here are very good. As a hospital, we certainly are above the national standard in terms of infection or complications after our surgery. And frankly, I think a lot of times this is because of being in a small hospital. A lot of times the sick people go to the big hospitals, and often we end up being shielded a little bit from some of these other illnesses. The function after a joint replacement over the years really has been a lot determined by what patients do, and they have taught us as opposed to us teaching them. And patients after a total hip and a total knee replacement become very functional. I have patients with these replacements who ride motorcycles, of course, ride horses. I've done them in farmers, policemen, firemen, that have gone back to work afterwards.